So this side of our ICU is our COVID unit. So we started 4 weeks ago. I think we had 1 patient in the ICU with COVID, and now we have 14. So this corridor down here is all of the COVID patients. Each one of these rooms has 2 people in it, and we can just walk you now.
Yeah, is it okay if...
Is ECMO in here too?
Yeah, so these patients, you might be able to see without showing faces, that machine over there with the screen.
Yeah.
So that's the ECMO machine. And you can see the blood's going into the machine. It's oxygenating the blood. It's taking the carbon dioxide out. So it's basically taking over the entire function of his lung. There's a catheter the size of a garden hose in his neck, and there's a catheter the size of a garden hose in his groin. And basically it takes the blood out of his groin, puts it in the machine, takes the carbon dioxide out, puts the oxygen in, and then pumps it back into his heart. And so basically completely takes away the function of his lung and does it for him.
That's lung failure from COVID.
From COVID.
Is this patient unvaccinated?
Yeah. COVID unvaccinated, yeah.
Can you say the age?
They're in their 40s.
In the 40s, eh?
Yeah.
So these are 2 COVID patients on life support.
On advanced life support, both are unvaccinated, and both are on the highest level of life support you can get anywhere.
I have to ask how that makes you feel knowing that they made a choice that may have brought them here.
Yeah, it's very frustrating. First, you know, you're interacting with their families who are really upset, and to know that their families didn't have to go through that and the patients didn't have to go through that if they had just gotten a shot that takes 30 seconds. It's frustrating. You just can't understand the rationale behind why you wouldn't get a vaccine, because we see this every day, that this is where you end up when you don't.
Yeah.
And I think these are the things that people need to understand. It's not an abstract concept. If you get sick with COVID and you get really sick, it doesn't matter how young you are, it doesn't matter how healthy you are, you could very well end up here. And once you end up here, your chances of survival are limited. It's frustration with the individual choice that the patient made. It's anger with the social context that got them to make that decision. It's anger with people posting on social media that COVID's not real or that vaccines don't work. That basically preys on vulnerable people who are trustworthy and forces them to make bad decisions that in some cases are lethal.
What's the youngest patient you have here? Can you walk us through? Is there...
Wait, I can. Yeah, we'll just let them do their thing.
Oh yeah.
So yeah, so that's another
You gotta push it.
ECMO patient.
You gotta go
He's
in
in his...
pull it out.
So this patient is in their early 30s.
Is in their 30s.
Early 30s. So this is the only patient we have left over from the 3rd wave, over 3 months. Just two young children and a family. Yeah. This man was totally healthy. He's not obese. He's got no other health problems. It's very scary. There's 3 physicians and respiratory therapists there doing a procedure where they're basically looking into the patient's lungs with a camera. Yeah, so we do this routinely for these patients because of COVID, their lungs get filled with secretions and other things. So, but you can see the amount of intensity that it's required just for a bedside procedure, which normally would be done with 1 physician and 1 respiratory therapist. These are, again, another 2 COVID patients unvaccinated on ECMO. So that's, 1, 2, 3, 4, 5, 6, 7, and then there's an 8th person there. So like a lot of patients go into kidney failure. So that green machine over there is a dialysis machine that's basically taking over the kidney function. It's a bit crazy that people don't believe it. It's kind of like someone telling you the sky's not blue, but you're looking at it and saying, well, it's blue, right? And arguing with you that it's not. We have had patients here that we've intubated in this unit who came to us not intubated. And I can think of one in particular. They just didn't get the vaccine because they didn't get around to it. And when they were getting intubated, they were quite upset, quite angry that they didn't do it, quite angry at some of the information that they had been given. Many of the family members of people who are here, who were originally unvaccinated and who were ardent vaccines supporters, after seeing their loved ones in here for about a week, have all gone and gotten the vaccine.
They're younger.
They're very young.
They're younger.
Yeah, it's totally different than the third wave. A majority of the patients are in their 30s and 40s. A majority of them are healthy, not even diabetes, not smokers, and they've just gotten severely ill with COVID.
What is it?
We don't know. We don't know. The thinking is there's some genetic predisposition, but it's scary because it's people that are like younger than you, and in some cases healthier than me, and they're getting sick.
Can you take any more patients?
We can. We don't really have the choice not to, because if, as a trauma center, as a neurosurgical center, or as a cardiac center, if a patient comes, we have to take care of them. But it definitely places a stress on our staff because they have to take care of more patients at the same time than they usually are asked to do.
Are you tired?
I'm very tired. Yeah.
I'm tired.
I could fall asleep right now if you let me. Yeah, it's everyone here. I mean, all of these, docs and nurses and RTs, all of them have been working more than they ever have, harder than they ever have, and they're all tired.
And the healthcare workers who get targeted, is it a personal affront for you?
I got some angry phone calls from people in the public because of my advocacy for vaccines, and it's frustrating, but yes, it's a personal insult that someone would take someone who's spending their time away from their family for long periods of time looking after patients, and someone on the street is just basically accusing them of being a liar. And then when you see this, which this is real, it's hard to kind of to square that away.
And that's part of the reason you're allowing us in here.
Yeah, I think it's important for Canadians to see that this is real. None of these people 2 months ago thought they would end up here, and now they're here. And some of them won't survive.
Are you scared what's coming?
Nervous.
Why?
Nervous because the third wave was very taxing, not just on us, but on our families. I have 2 young kids who I went for weeks without seeing because I was in here. And so that's just not something I want to repeat. And I think everyone here has family and friends that they're, even as right now, kind of not seeing because they're here working. So I'm nervous about that because I don't know how much more. Everyone has a limit, and everyone's limit is different, but I think we're pushing people's limits.